And go ahead and let it out.
There it is. There it is. Got a whole lot of them this time.
I already feel like a new person.
Said
I already feel like a new person. No, really, great.
Felt pretty good. No pain.
It's like a release.
Right, right. No pain, right?
Good.
That's good. Hey guys, Dr. Clerge, a DMV chiropractor, and I'm here today with Carissa.
Yes.
All right, so Carissa, you had a lumbar surgery, right? Lower back surgery, fusion. Possibly L4, L5, L5S1. You're not completely certain, right? Okay, but it is in the lower
back.
Gotcha. So I'm assuming you've been having some aches, soreness, stiffness
Every day.
Yeah, and then also you said neck, upper back, lower back as well. Okay. You said you saw a chiropractor?
Yes.
Before? Okay. How did that work out? Okay.
It's fine. I mean, it relieves some pain. You're able to go maybe like 2-3 times a week. But I really was looking for somebody that did the neck part too.
Okay, gotcha.
Yeah.
The whole thing. I see. Okay. Well, usually chiropractors do the whole thing. You know, they should be able to do the whole thing, but you know. All right. So because you had the surgery, there are certain maneuvers that we can't use. Okay. So like for example, I know, have you seen any of our videos?
Yes.
Yeah. So the side posture move where you're on your side and we're actually applying a torque, we can't use that move because, you know, if it's a fusion, we don't want to aggravate it. Okay. But there are little things we can do, like we can do certain stretches, okay? We can also target the muscle. So like your lumbar erectors, we can have them massage it to kind of decrease any tension. So those type of things we can do because they're safe. Okay. However, we can adjust the other parts, you know, like your mid-back, upper back, neck, we can adjust those parts, okay? So that should give you relief. So at least the adjustment from the mid-back will create some motion and it'll decrease tension also in that area, okay? So let's start by examining you, okay? So I'm gonna have you on your back for me. All right, so interlock your fingers, put it on your belly for me. And I'm going to lift your legs and you let me know, besides tightness and stiffness, if you have any back pain.
Okay.
How's that?
I'm fine.
You're fine? Okay. You're fine? Still? Okay, good. All right, relax and drop the leg. Good. Let's go to the other side. We're gonna lift the leg again. You let me know if you have any back pain with that. That's okay? Besides tightness in the hamstrings?
Yeah.
Okay, gotcha. Okay. All right, perfect. Okay. Let me have you sit up for me.
Okay.
Good. All right. Now, let's just do some motion. It's not just bend forward, so just go forward for me.
This is as far as I can go.
This is as far as you go?
And
it starts to hurt at that point?
On my lower back.
Wow. Okay.
I know.
Let's have you go back.
My range of going back is fine.
It's fine. So moving
Just
forward is uncomfortable. Let's have you rotate for me. It starts to hurt at that point. Let's have you rotate again.
Right there.
Right there, as far as you go. Okay, let me have you stand up. Now, let's have you try and bend. Don't bend your legs. Try to touch both feet, but you know, once you start feeling uncomfortable, you stop. Okay. I'll hold you just in case. Okay.
Right here.
This is as far as you go. And you start feeling pain. Okay. All right, move up for me a little bit. Both arms up like this.
Like this.
And don't do it yet. You're going to rotate right and left, okay? Now I'm going to hold on to your hips. That way you're not moving your whole body. You're only moving your lower back, okay? All right. Go ahead and turn to the right.
Right there.
This is as far as you go. Okay. Turn to the other side.
Right there.
That's as far as you go. Okay. All right. Now keep your arms up. We're going to go side to side. So this side and that side, okay? Go to the right.
Right there.
Right there. Go to this side for me.
Right there.
Okay. So that's very limited.
Yeah.
All right. Have a seat.
I may look young, but I'm in an 80-year-old's body. Okay.
All right. So have you been like this since the surgery, or did you have better motion after the surgery?
I had better motion.
After the surgery.
Yes.
So, okay. And then it started to decrease slowly?
Yeah, and I don't know why. Maybe I didn't stretch enough. And I also went to therapy.
Physical therapy.
I probably should have went longer.
Longer, right. Oh, you should have kept up with it, even
Yes.
if it's once a month or something like that.
Yeah.
Okay, I see.
And I should probably do, more stretching. I stretch at home.
Absolutely.
Just to relieve,
especially for the lower back.
So I sit on the floor. The stuff that I do, I sit on the floor and my husband pulls my arms and just try to stretch. I bend a leg and stretch. It gives me a little bit of relief, but after I'm still going to take like Advil or something.
I see.
Yeah. But my back is crazy because my back doesn't hurt every day. There's some days that it's like, that's all I think about is my back. And then others, I wake up and I'm fine.
I see.
Yeah.
Okay.
So I definitely can't walk like long distance.
I see. So you have to increase your activity. You can do it slowly. Okay. We'll do certain stretches. I'll show you. What to do.
Okay.
And once we post the video, you'll be able to see what we're doing. So your husband can kind of like replicate those stretches. Okay. All right. Have a seat. All right. So. Now let's check your head and neck range of motion, okay? So I'm gonna have you look down for me and just do it to the point where you're comfortable.
Just my neck? Right there.
Right there? Okay. Try go a little bit more. Let me know what you feel.
I just have a little bit of
tension.
Yeah, on this side.
On this side. Okay. Let's have you come back up. Now you're going to rotate to the right and rotate to the left, but don't do it yet, okay?
Okay.
All right. Let's go to this side first, slowly. What are you feeling? That's fine?
Yeah.
Okay, let's go to this side now. You're fine? Okay, gotcha. All right. Now we're going to go side to side. Okay. So let's go to this side first. And you let me know what you feel when you start.
There's tension on the left side.
On this side. All right, now let's go to the left side. What do you feel?
Just a little tension.
A little tension? Gotcha. Okay. All right. But it's still, you should be able to move a little bit more. Okay? Like when I do this, is that a bit tight?
Yes.
It starts to get tight, right? So comfortably, you're rotating, but not all the way. Okay? Once you start to go a bit farther, then it creates tension. So that's the point of the adjustment, to kind of increase that range of motion for you. Okay? All right. So one more thing I want to do.
Okay.
I'm going to apply a little bit of pressure. That's okay? Rotate. That's okay? Rotate.
That's okay. a little
bit of tension right here? Okay. All right. So we'll start the stretches. I have young ladies stretch the upper part.
Okay.
And I feel more comfortable if I stretch the lower part because you had the surgery.
Okay.
Okay?
What you're going to do is you're going to step up to the wall just like this. You're going to take 2 steps back.
Okay.
2. You're going to place your hands on the wall just like this and make sure that they are even. And you're just going to lean in this way. So you don't want to lean in with your entire back because, of course, you're not going to stretch anything out. So I'm just going to stretch out your shoulders up in here. So you're here and you take a deep breath in and let it out. And that's pretty much done. You're going to do that 3 times, okay? Yes, ma'am. 2 steps back. That's perfect.
Is that 2 steps or 1?
That's fine.
Okay. Okay.
You have to make sure they're even. Come up from just a little bit. Perfect.
Okay.
How's that? You comfortable? Okay. Now go ahead and take that big deep breath and lean in and let it out. How's that for you? You should feel it all over here, right? Good. Let's hold that. Come on back. And let's do it again. Deep breath in. And go ahead and let it out. Comfortable? Okay. We're going to do it one more time, okay? Big deep breath in. And go ahead and let it out. We're going to hold this one a little bit longer. Perfect. Now come back out.
Feel me shaking? I'm like,
yes.
I'm
just going to apply a little pressure here like this. I'm going to slip my hand right here. Apply pressure here. You're going to take a big deep breath for me.
Okay.
And go ahead and let it out. How's that feel?
Nice and tight. Stretching it.
Yeah.
That's what I mean.
Gotcha. We're going to do it again. Big deep breath. And go ahead and let it out. Good. I want to do it one more time. Big deep breath. And let it out. Good. Now we're going to switch to the other side, okay? Mm-hmm. All right.
Look, you guys make house calls.
No, but you now should. All right. Big deep breath in. And go ahead and let it out. How's this side?
This side's not as tight.
Okay. We're going to do it again. Big deep breath. And go ahead and let it out. And go ahead and let it out. Good. Perfect. Good. Now you can go ahead and sit up. And Dr. George will be in to see you now, okay? All right.
Thank you.
How was that?
Good.
Good.
All right, so you sleep on your side, and then sometimes you'll end up on your stomach, right? Okay. Sleeping on your side is not too bad, okay? On your stomach, it's probably not the best position.
Okay.
Because when you're prone is what we're calling it, you're on your stomach, and your head is rotated, so imagine being in that position for hours. Okay, so when you get up, obviously you were putting a lot of strain in the cervical musculature. That'll create tension, okay? So the best way to sleep is on your back, okay? And then we'll go over it and you let me know how you feel.
Okay.
All right, so just go ahead and lay back down for me.
That's just painful.
That's painful?
Yeah.
That's uncomfortable?
It's
Especially
just right here.
for that lower back? Okay, it's time you come back up. All right, so slide down for me a little bit. All right, now let's go ahead and lean back. Now, I know for the lower back might still be uncomfortable. As far as your neck.
But honestly, even this is better.
Better than when you were just flat, okay? All right, so now let's lift both legs up for me. And just let your leg down. Good. How does that
I don't feel any pain.
That's good, right? Okay, so with the elevation of your legs, obviously you can use something larger, like a larger foam, or if you're using pillows, but several pillows underneath your legs, okay? What happens is that when your legs are elevated, it decreases tension to that lower back, okay? So the higher the elevation, the better. You know, to the point of comfort, of course, right? And then for the pillow, you need something like this, a cervical pillow, something with like an S shape that'll support your neck,
I've seen this before.
Right, so you can just, on Amazon, you can just, you know, you type it in and it'll pop up, okay? So do you think you can do that, or that's too, you know, you think it'll be uncomfortable for you to be in that position for a long time?
I don't think I can actually sleep like this.
Like this?
You know, I would have to train myself to
right.
Because I feel like I move too much.
You move too much, right?
Yeah.
So maybe you start slowly, like you do it for like 15 minutes, and then you go back to your normal
Right,
position.
or like if I'm like even just relaxing, I could do this.
Do that, right, but then to actually sleep, it's not going to happen, right. Well, you could try it and slowly increase the, you know, the length of time, okay? So the first time 15, and maybe 20 and 30, and then until you work your way up to maybe trying to, but that's the best position, okay? Now, if you're on your side, what you want to do is place a few pillows in between your legs, okay?
Like pregnant people do.
Exactly, because what happens is that it'll help decrease distension, because it'll help balance everything out, okay? So that'll help at least. If you can't do that, then on your side, pillows between your legs. You can get a pillow for side sleepers. So for folks who sleep on their sides, they do sell those as well on Amazon.
I've never even heard of that.
Okay, so that'll help. With some of that lower back issue that you're having, okay? On your stomach, I don't recommend. All right? So let me take this off. Let's go ahead and bring you up. Just grab my arms. And there you go. Perfect. Okay, all right. So now we're gonna stretch the lower extremities and a little bit in that lumbar, okay? To kind of increase a little bit of that range of motion. So the easiest one, let's have you stand up for me. I'm going to put the left hand on your hip, this arm is coming up, all the way up.
Okay.
And I know your motions are limited. We're just going to go to the other side, but very slowly, okay? You're going to take a deep breath, and then so I'll do it first, okay? Basically, you're taking a deep breath, let it out. So as you're breathing out, you're actually stretching, okay? That'll help increase that stretch for you a little bit more, okay? So arms up, don't do it yet. Okay. You're gonna take a deep breath, blow it out, and you're going to feel the stretch like right in that area right here, okay? So let's have you come this way for me. Now I'm just gonna hold on to you that way, I'm just guiding you, okay? All right, so this arm up, and I want you to take a deep breath for me. Let it out, go to the opposite side. When it starts getting uncomfortable, you stop, okay?
Right there.
Right there. Okay, good. All right. And let's go back to the regular position. Okay, you can put your arms down and rest a little bit, okay? So we're going to do it one more time, okay? This arm will come up. Take a deep breath for me. Let it out. Go to the opposite side. And when you start feeling uncomfortable, you stop. Right there? Okay. Bring the arm down. Okay? So the goal is to try and get you to increase that motion and go a bit farther. Okay? But not initially. Because you haven't been really stretching like that. Okay? As you do it, as you know, the more you stretch, the farther you'll be able to go. Okay? So let's do it one last time. Okay. Now, let's have you spread the legs apart a little bit more for me. Okay? This hand will be on your hip. We're going to do the same side. Same side, yep. We'll be up. Take a deep breath for me. Let it out. Relax, relax.
Right there.
Right there. Okay. All right, good. Now let's go to the other side. Okay. Same thing. This arm's up. And let it out. There you go.
I can go further.
You can go further on this one? Okay.
Right there.
Right there is fine. Okay, good. All right. Rest. And let's do that one more time. Good. And let's go to the other side. Relax. There you go. Perfect, perfect. Good. Okay. All right. One last time on that side. And take a deep breath. Let it out. And stretch. There you go. Perfect. Good. Okay. So I would say you want to do this daily, okay? Maybe twice a day, okay, to start increasing your motion. And I'll probably see you maybe 2-3 months or so. Unless you get super tight again, then you know you can come back sooner. The goal is for you to get to this side, okay? But slowly you should be able to, okay? Right now you're like right here, okay? So if you continue to do it, you should be maybe like around here, and eventually to this side, okay? All right, let's have you on your back. I'm going to use the pillow because I know when you're on your back that's uncomfortable, right? Slide down for a little bit. All right. So I'll do a few stretches for your lower extremities, and we're going to target the piriformis muscle here. We're going to target a little bit of that SI joint, okay? But it'll be light stretches. I won't go as far, okay? If it starts to get uncomfortable, of course you have to let me know, okay? Let's interlock your fingers, put it on your belly for me. Good. I'm going to take this leg, I'm going to bend this leg like this. Good. You're good so far? I'm going to put my knee against your hip, and we're going to go across, okay? Now, when you start feeling uncomfortable, you let me know. Just let me know at what point.
It's not hurting my back.
Okay.
Definitely stretching my...
The hip? Okay. Yeah, good. Okay. Your back is good for now? Okay. That's good? Okay, good. Take a deep breath for me. Let it out. Good. Deep breath. Let it out. Good. One last time. Was that uncomfortable?
Mm-mm.
Relax, 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 relax. Is that uncomfortable besides the hip?
Mm-mm.
No. Good. Okay. Let's go to the other side. This leg is coming up. All right. Let me know at what point you start feeling, but relax your body. Just let your body go for me. There you go. Good. Let me know at what point you start feeling uncomfortable. Well, you're super tight though.
Yeah, I know.
Yeah. Is that okay?
Mm-hmm.
All right.
That's crazy because I thought I was relaxed until you told me to like really
Yeah, yeah. Because you're like
I'm like
stiff. Yeah, you're all stiff.
I don't know why.
Right. Yeah.
I don't know why.
Take a deep breath for me. Let it out. Relax, relax. If you get uncomfortable, let me know.
No, I'm fine for some reason.
That's not too bad?
Mm-mm.
Good. Okay. One more time. Deep breath. Let it out. Good, 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 good. Okay. Okay, relax, relax.
Mm-hmm.
Deep breath. Let it out. Good, 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 good. Perfect. Okay. That wasn't painful, right?
Mm-mm.
Okay. All right. The next stretch, we're actually going to bring both legs kind of like up to your chest, but we'll do it slowly.
Okay.
That one you should feel like with the glutes, you should feel like a little bit in that lumbar area also. Like it should like open that lumbar area. All right. So let's unlock your fingers. Just drop them down for me. Good. All right. You'll have both legs come up. You can just relax your legs. I'll do all the moving for you, okay? All right. Now, if at any point it starts to feel uncomfortable, you let me know. Let me know at what point.
No, I'm okay. I don't know why it doesn't hurt me.
That's okay?
Mm-hmm.
What about now?
I mean, I feel a little bit of pressure.
Feel a little bit of pressure?
Mm-hmm.
Okay. At this
It's not,
point.
but it doesn't
Hurt.
Mm-hmm.
But at this point, right?
Mm-hmm.
Okay. All right. Just take a deep breath for me. Let it out. And just relax your body. Okay, relax, relax, relax. Good, good. Both legs are coming up. Good. All right. Take a deep breath for me. Let it out. Relax. Let me know at what point you start, because you're still tight. How do you feel? Is that okay?
Yeah, this is okay.
You start to feel a little pressure?
Mm-hmm.
Okay. One more time. Deep breath. Let it out. How's that?
Okay.
That's okay? Not too bad?
Not too bad.
Okay. All right. One last time.
Okay.
Drop the leg. All right. So remember, when you take that deep breath and you let it out, just relax your body.
Okay. You know, it's actually hard to do.
It is hard to do. Yeah.
I don't know why.
So, what happens is that if you're thinking about it.
Okay.
So deep breath, let it out, and then you'll feel the pressure, but you just continue to let that breath.
Okay.
That actually will help you stretch a little bit more.
Okay.
Because if you're thinking about it, you're not breathing, and you're tight, it's, you're defeating the purpose,
Okay.
basically.
Okay.
All right. Okay, so this leg is coming up. Good. I want you to take a deep breath for me. Let it out. Relax, relax. Don't think about it, just relax. There you go. Perfect. Good. Okay.
I did better that time.
You did, yeah, you did
I
better.
feel
Yeah,
it.
I feel it. Yeah, I felt
Yeah.
it. Yeah, yeah. All right, let's bring this leg down. And now, we're gonna do one leg at a time, okay? So you actually probably get better range with one leg at a time. All right, so deep breath. Let it out. Relax. Let me know at what point you start feeling pressure.
Right there.
Right there. Good. Let's go again. Just relax for me. Deep breath. Let it out. Relax, relax. Let me know at what point you start feeling pressure. Right there?
Mm-hmm.
Okay. Take a deep breath for me. Let it out. And let me know when.
Right there.
Right there. Gonna push out just a little bit more. Good. Okay. So remember, the goal is to increase your motion.
Mm-hmm.
So the more you do it, the more you'll be able to go, okay?
Okay.
So when you get home, we'll post a video probably like a week or two. When we do that, just have your husband look at the video so that way he can reproduce the stretching. Okay. This leg. All right. It's coming up. Same scenario. Take a deep breath. Let it out.
Right there.
Right there. Good. One more time. Just relax for now. Take a deep breath for me. Let it out. Let me know when right there. Good. We're going to do it one last time. But this time we're just going to add just a little bit more pressure, okay?
Okay.
All right. Deep breath. And let it out. Relax, relax, relax. There you go. A little bit more pressure, a little bit more pressure. Perfect. Okay, good. All right. That's good. Okay, now, this one will feel a little uncomfortable, but let me have you sit up for me. I'm going to push you forward, but just slightly, okay?
Okay.
Most people can go all the way down.
Oh, that's not
I know that's not the situation with you.
Now, should I tell you what? I mean, even though it's pain, like, tightness, is it okay if I let you go a little further?
No, that's fine. Yeah, as long as it's not too painful.
Okay,
Right.
Okay.
But when you start off, it's like going to the gym. When you start off, you start slowly.
Okay.
Okay, and you can always increase the motion because your body will get used to it, will adapt to it, and then you can push further. Okay. All right. Okay. So both arms out like you reach out for both feet. Take a deep breath for me and let it out. Good. You starting to feel the pressure now? Okay, good. Let's go back. Relax. All right. And let's do it again. Deep breath. Let it out. Relax. Pressure. Yeah.
And it's it's the right side.
It's the right side, yeah. Okay, good. Relax for me. Reach out. Deep breath. Let it out. Pressure, pressure, pressure. There you go. Good. Okay. All right. Good.
Believe it or not, I was athletic. Okay, back in the day.
Right. Yeah. You told me. Yeah. You're like you did.
It may not look like it now, but
gymnastics and everything. But after surgery, it does decrease motion. But you just have to continue.
Yeah.
Stretching. I suggest yoga.
Okay.
Just the first basic steps. Okay. All right. So now we're gonna start with the adjustments for the mid back area, upper back, and the neck area. Okay. All right. You are so tight.
I know.
Yeah. It is super tight. Okay.
Wait, why do you think that is? Is that just because I don't stretch enough? Or why am I?
It's a number of things, if you have decreased activity, if you're not stretching,
don't exercise at all.
Right. So then that creates that tightness.
Yeah.
But some people do have different physiologies. Some folks just have tighter muscles than others. But it shouldn't be that tight.
Yeah.
You just gotta increase the activity.
Okay.
All right. So I'm gonna have you slide forward for me a little bit.
Okay. Keep going.
Right there. No, right there. Fine.
Okay.
I'm going to bring the table up. So I'm going to start with this portion here, okay? So let's have you slide a little bit more. Good. You're going to straddle the table, so both legs are going to be apart like that. Good. You're going to give yourself a hug. Good. Okay, I'm going to bring you all the way down, okay? So I know when you're on your back, it's a little bit uncomfortable. So if it's too uncomfortable, you let me know. Let's go back down. And okay, when you go back, you're gonna keep your head tucked in like this.
Okay.
So you're gonna feel a little bit of pressure here and here, but you're going like this. I'm bringing you back. Okay. All right. Keep it tucked in. Deep breath. Let it out. There it is. Deep breath. Out. Good. You felt that? Come on. Okay. Good. All right, you can uncross your arms, okay? Okay, relax. Relax, relax. Feel something move already. Relax. There it is. Yes, ma'am. Was that painful? Good. How did that feel?
Great.
We heard it though.
Yeah. I heard it the first time you did that little turn.
The turn, yeah, I felt it, right. All right, let's go to the other side. I want you to relax for me. Relax. There it is. Got a whole lot of them this time. Did that
I already feel like a new person.
Said
I already feel like a new person. No, really.
That was a lot. Sit up. All right. So now, how did that feel, first of all?
It felt great.
Felt pretty good? No pain?
It's like a release.
Right. No pain, right? Okay. So now, my focus is going to be the cervical spine, okay? So let me have you rotate for me. Rotate again. Okay. Do it a different way this time. So, when I tell you to drop your head, you're just going to drop it, but you got to relax, okay?
Okay.
All right? Okay, drop your head for me. Was that painful? How did that feel?
Good.
Not too bad? Okay, let's go to this. All right. Same scenario. And I'll tell you to drop your head, drop your head. Relax. Good. How was that?
Good.
Not too bad? All right, let's have you move your head around for me.
Good.
That's good? Okay, all right. So now what we're going to do, we're going to focus on massages, okay?
Okay.
The thing is, because of the fusion, so we're limited to some of the stuff that you see, because they're very aggressive.
Yeah.
You know what I mean?
Yeah.
So we don't want to do a whole lot and create problems for you.
Okay.
So the maneuvers that I just use are very safe, okay? Like when we did the table and I dropped, that only focuses on the mid-back. Okay, even the one we went back only focuses on the mid back.
Okay.
Certain adjustments would actually get a little bit of the lumbars, so I didn't want that. Okay, because I don't want to go to that level. You see what I'm saying? So it was a little bit more passive than most of the that you see. Okay, all right. So now my goal is to have them focus like here. Okay. Especially that lower back is right here. I mean, it's.
Oh, I know.
You know, it's super tight.
Yeah.
Right? So they're going to massage this area here and then here. And then, of course, if you feel uncomfortable, like if you feel there's too much pressure, you let them know.
Okay.
Okay?
All right.
All right, let me have you stand up for me and just move around a little bit. Let me know how you feel. I mean, I don't expect you to feel like, you know, but...
I'm not in any pain, though.
Right. Okay, good.
Yeah, I'm not in any pain.
Good.
Which is good. I actually feel like I'm asleep good tonight.
That's what the last lady said.
I feel good.
You feel pretty good? Not too bad?
Yeah, not bad at all.
Okay. So now, the next thing they're going to do, they'll focus on massages.
Okay.
And that'll target mainly the muscle. Okay, so we want to get, because it's still super tight. We were able to get some movements with the adjustments. Up here, especially right here, that was extremely loud. And then we got that cervical, which targeted the mid-cervicals, okay? Once again, like even the Y strap, because the Y strap sometimes will go all the way to your lower back. That's why I didn't do that.
Oh, I seen that.
Yeah, when you pull, that creates a lot of relief. Yeah, but you know, for some people it'll stop at the mid-back. But for some folks, it'll go all the way down to the lower back.
Yeah, we don't want to take the chance.
Right, it's so it's better to be safe than sorry. Okay, so everything we did was just very safe. Okay, very passive, but very safe. Okay? So next step, massage.
Okay.
All right? Cool.
Thank you so much.
No problem.
How's this? How's the pressure?
Good.
Mm-hmm. How's this here?